Hello, welcome back to my YouTube channel, and this is Roja. I'm happy to see you all again. And as you all know, that I have been making some videos related to nursing research, and as a part of it, today I would like to release this video on qualitative research designs. As in my previous video, I told you I'm going to make on this. It's a small video, but yet very informational. We'll just see about what are different types of qualitative research designs and the meaning of them, and with some examples. Qualitative research design, as explained earlier, I said, like when we want to describe a characteristic or an attribute or a trait of a person, we use this qualitative. And when it is something numerical, when the data what we collect, percentages or ratios, we use quantitative research design. So coming to qualitative research design, it is an approach concerned with subjective assessment of attitudes, opinions, behaviors. It is a systematic, subjective, methodological approach used to describe life experiences and giving them meaning. Mostly when we say qualitative, this research tries to find an answer to what had happened, where it happened, when, who, why, and how this happened. It tries to answer all these aspects, and it involves some things like attributes, opinions, behaviors, experiences of the individuals. Coming to different types of qualitative research designs, first one we have is phenomenological. Phenomenological research design, the researchers selects this design when he intends to describe the circumstances which he is impressed with, or when he tries to describe lived experiences of people, or if he wants to generate some theories, phenomenological research approach is used. For example, if we take lived experience of people who had earthquake in a particular place, or lived experience of people who have survived after tsunami, or lived experiences of people after being affected with COVID-19. So phenomenological research design especially, it deals with some of the occurrences which impress the researcher, or the life experiences in which where the researcher is interested in doing the research. He selects phenomenological research design. Next, coming to ethnographic. So ethnographic, when we say, it mainly deals with the cultural aspects, socio-cultural aspects, like different people living in different areas do have their own socio-cultural beliefs. So in order to describe those attributes or behaviors of an individual, researcher can select this ethnographic research design, the culture of people. And herely this research design is mostly chosen by anthropologists who try to describe people, their socio-cultural beliefs. Coming to nursing aspects, maybe we can use an example of socio-cultural belief of people regarding child marriage in so and so area, or socio-cultural belief of individual related to drug abuse or terrorism or child abuse in particular area where it is common, or socio-cultural beliefs of people living in certain areas like tribal areas, you can compare. So when a researcher wants to do a research on cultural beliefs and society, particular societies, he will select this research design, ethnographic research design, and especially anthropologists do select this research design. But I have given an example related to nursing field, like socio-cultural belief of people regarding child marriage in a particular area. Next, coming to grounded research, that word itself, grounded, means roots. The roots are fixed in the ground, and we have a surface that is the present, and the researcher, he tries to identify the gaps which occur between the present situation or the present presentation, and he knows definitely where the roots are, and he makes a research to bridge the gap between this two, the present and the past. So he wants to bridge the gap between these, whatever is deficit there. He uses this grounded research. For example, already a person has been affected with a certain condition or suffering with quadriplegia, and and at present you can see how he coped with that condition can be assessed. Maybe, for example, you can take a study to assess the ground level study or a ground research to assess the adaptation level of patients suffering with quadriplegia. You can use this. A grounded research on adaptation levels of patients suffering with quadriplegia in a particular hospital or a particular setting. So already persons are suffering with quadriplegia. They have that in present, but how they coped, how they adapted themselves when they're suffering with that condition, we want to know. That is called as grounded research design or grounded theory. Next, coming to case studies. When we say case studies, you take an individual case. And in nursing, mostly we are used to doing this case studies. Take an individual case. It is an in-depth study of a particular individual who is having some health condition, because we are dealing with nursing, and what type of care is provided, how the person coped up with the situation and all. And you deal with all areas in that particular case study. Coming to historical research study, it's all about the past. When we use this historical research design, for example, if you take, you want to do how a research study on how actually nursing midwifery council in Andhra Pradesh has been established. So what you do, you go back to the history, how it started, actually when it started, where it started. So all these aspects will come, like when, where, how, what, all these aspects. So historical research related to Nursing Midwifery Council, how it established Andhra Pradesh. Okay, history of nursing, how it started. So when you go back, like when you see every subject, whatever we discuss, initially we see history of development of psychiatric nursing, history of development of nursing research, history of development of nursing foundation, nursing. So we see nursing foundation. This is how the research is done, historical research. Then coming to action research, when we say action research, it is implementation and outcome. You see, you do some procedure, what is the outcome of it? This can be done for this. This intervention can be done if the patient is suffering with this. So you provide that, you do that intervention, and you see the outcome of it. That is how action research design is selected. So these are all few qualitative research designs: phenomenological, ethnographic, grounded case study, and historical research, and action research design. It's a short video, but I hope it is very informative for you, and hope you all have understood. So we'll meet again soon. In my next video, I would like to discuss regarding descriptive research designs, then correlational and developmental research design, and we have other research designs like non-experimental research designs. We will just go through that in detail. So I would like to meet you all pretty soon, but before we just move ahead, please don't forget to share my channel, subscribe my channel, and do comment. I just asked if you would like to me to explain to you in Telugu as well. Just put a comment. Thank you all very much. Bye for now.